Hello everyone, this is Dr. Siddharth Acharya and I have secured an All India rank of 439 in NEET PG 2022. I am currently pursuing MD General Medicine at Medical College Kolkata. In this short video, I am going to discuss few practical tips that might help you in dealing with your first year residency. First of all, I would congratulate you all for making your way up to your dream branch and your dream college. You have finally made it, so you should congratulate yourself before anyone else does. You have really done a great job. You have cracked the most difficult exam of your life, probably. And so, welcome to residency. Yes, welcome to first year residency. It's going to be a roller coaster ride. It's going to be tough at times. It's going to be easy at times. So, it is altogether a roller coaster ride. A new place, a new college, new language, new food habits, everything is new for you. For many of you, I would say, many of you have joined, many of you are yet to join. Whatever might be the case, I will help you all with few practical advices which I have felt, which I have experienced during my first year residency, and this might be helpful in dealing with your first year residency. So first of all, take it easy and don't panic. You might feel just after entering your day 1 or day 2 of residency that you don't remember the easy stuff. You don't remember what used to be a cakewalk for you. You are finding all those stuff very difficult for you. You are finding that everything is going above your head. What is being discussed during the rounds, you're not being able to grasp in maybe the first week or so. But mind you, this is the thing which has happened to all of us, all of who have entered after so many days of gap from NEET PG. We have all forgotten easy stuff. What used to be like just a cakewalk for us, now that seems that seemingly easy thing now is appearing to us as very difficult. We are not remembering easy stuff. So take it easy, don't panic, because this branch which you have taken, this branch will remain with you for the lifelong, right? You can learn it step by step. You have to master the entire branch, but master it step by step. Expect don't expect so much out of yourself that you will be able to perform everything in the first week or maybe in the first month, right? So don't panic at all, take it easy. My second, or rather the most important advice would be to keep your health at your topmost priority, because mind you, this first year of residency, at least the first year of residency, is going to be very difficult. There will be no fixed schedule, there will be no fixed eating habit, there will be no fixed sleeping time. But amidst all that chaos, you need to find yourself that time for your health. Maybe a 15 minutes of a simple workout, a simple freehand exercise, eating healthy, sleeping whenever you get time for, let's say, a 6 to 7 hours of sleep every day. If you manage all this out of your busy schedule, it will be helpful for you. It will help you cope up with your residency, because if your health crashes, then it's going to be very difficult. Don't compromise your health above everything else, right? So it's going to be difficult, but if you keep your health at top notch, you can function very well, right? This is my big advice for you, that amidst all the irregularity, try to find some sort of regularity. Maybe you can, after let's say 1 week or 2 weeks, or maybe after one month, you can find some regularity in your irregular routine and utilize that regularity entirely for your health. Maybe work out and do some 5 minutes of meditation, simple stuff every day. 5 minutes of meditation, 15 minutes of workout every day, eating healthy. All this will help you cope up very well in your first year residency. Second thing, rather the third advice is, the morning round is for the consultant and the evening round is completely yours, right? During your morning round, there will be your seniors, there will be your consultant, and your consultant and your seniors will discuss many things which you might not understand, which you feel that everything is going above my head. It's okay, it has happened with all of us seniors, right? So take it easy. You just try to absorb whatever is being said to you during the morning wards, whatever is being discussed about the patient. You just jot down in a small notebook if possible, or maybe just observe what they are doing. Don't expect to grasp everything in the morning round. Now when the everything is over, you are getting your time in the afternoon, in the evening. All that time is yours. You talk with the patient, you examine the patient, you spend time near the bedside. Only then and only then, if you spend your time judiciously in your evening round, in your afternoon, then only you can able to learn whatever is being discussed in your morning. So don't overstress yourself, rather spend your valuable time, your full attention during your evening and the afternoon, right? And this is an important advice which my seniors, which my teachers used to say, that one case a day keeps fear of missing out away, right? So in your in your ward, under your unit, under your team, there might be, let's say, 15 patients, 20 patients, 25 patients. Everyone is your patient, you have to take care of every one of them, right? But how can you enhance your care for the patient without knowing about the disease process, right? So it's not possible for you to know everything, every 25 patients of every week. Rather take one patient, target any one patient. If it's a medicine round, medicine ward, take, let's say, a patient of hemiplegia. If it's a surgical round ward, take, let's say, a patient of cholecystitis. You target that patient, you go home every day. Let's say you are getting 15 minutes of time every day, you study for that patient. And of course all your patients will be priority, but one of that patient, that single patient which you have targeted, you study about that patient in details from whatever source you have. And there are multiple sources available on the net, like Up to Date, and you have your notes of your NEET PG days, you can study that also. Study little by little, but target it should be a case oriented approach, right? Rather than studying everything like system wise or chapter wise, it won't help. You should study whatever there is, whatever patient is there in your ward, because there is a well saying known as it goes like, what the mind does not know, the eye cannot see. If you do not study what is there in your ward, you cannot observe all those findings in your patient, right? And my last advice will be to, you should master the art of filtering the clutter. What do I mean by this? By this I mean that whatever is being said to you, if you are being scolded, if you are being looked down upon by your, maybe your seniors, your teachers, whatever it is, you should learn to filter out what is the most important thing they are saying. For example, if they are scolding you very badly about a patient's care, you separate that scolding out of that important thing, that why have not you taken that important, let's say, ABG of that patient. You are being scolded for not doing the ABG of the patient, you are being scolded for not doing the CT scan, or maybe not doing the catheter of for that patient. You notice, only you take out that important thing out of the 5 minutes or 10 minutes of scolding you. This will help in calming your mind, and your mind to focus in the actual thing what is being said to you. Remember, patient's care above everything. If your patient's care is compromised, try to reflect upon yourself, that what went wrong on your part, rather than taking all those scoldings and looking down upon yourself very seriously. Don't take all those very seriously, rather take the main thing out of their scolding. This might help you in dealing with what is known, popularly known as toxicity, right? You should be very much focused on the patient and not on anything else. You should be very much focused on your day to day ward round and your work, right? So with all that, yes, all the very best for your first year residency and upcoming days. Take care. Bye bye.